Welcome back to Roic Knows Podcast, helping you become a better and more informed you. Let's talk today about how you can enhance postoperative wound healing and prevent or treat normal wound healing, the hypertrophic scars, or the keloids, which are the abnormal scars. So how do we do that? And what is the magic behind postoperative wound healing, and does it matter? Well, I think it truly does matter. I mean, one of the most important things in wound healing is obviously getting the wound closed meticulously. That means closing the dead space and actually doing a layered closure in a very meticulous fashion so that the skin is edge to edge and sometimes even everted. That's very important. But then from there, a lot of it depends upon the genetics and how the wound heals, if you get an infection or not. But let's take a deep dive into evidence-based treatments that truly improve surgical outcomes. Because I would say 80 to 85% of the time, all you need for normal, good wound healing is a moisturization of the environment and to keep it, well hydrated, with a hyaluronic acid. I mean, a lot of the post-wound healing compounds are just hydrators of the skin. If you've got all of those things in order and you have normal wound healing and you don't have genetic problems with keloiding and things like that. So what I tell my patients is that, I want to see them when the wound's healing nicely. I'll see them at 2 to 4 weeks. And if there's any evidence of hypertrophic scarring where there's a little redness, that's when I begin the gold standard, which is silicone sheets. Silicone gel sheets are by far the number one evidence-based way to minimize hypertrophic scars and keloid scars, because the key is you want to prevent them. You don't want to use them to treat it. Once you have a hypertrophic scar or a keloid, it's hard to treat it. But if you have silicone sheeting, that provides some uniform pressure in that area, and you have to use it for 6 or 12 months, a long time. So you apply it early at post-op, and then you use it for 6 to 12 months. And we've learned this a lot from the use in hypertrophic scars and keloids from burns. So that's number one, the gold standard. And the gel is secondary. The gel sheets are number one, but the silicone gel is second. So that's number two. So these are scar sheets. They're available on the internet. They're available on Amazon. You can get rolls of them. Put them on your abdominoplasty and your areas where you have hypertrophic scar potential. And the key 3 areas where you can get hypertrophic scars is the sternum, the deltoid, and the back, where you have thick skin. So those are the ones I actually treat prophylactically. The other ones I don't. And then, believe it or not, medical grade honey. Mantua honey is really amazing because it accelerates wound healing, it reduces infection, and so it's kind of an older way of treating it. But you know what? It works. I never was a believer in this until I've seen it, especially when I've been on some trips in developing countries where I'm doing cleft lips and palates. I mean, it's amazing the power of honey. Applying it directly to the incision site, it's best for early stage healing. It's pretty amazing. So there's some good data to support that it enhances wound healing and minimizes your risk of infection. So this is truly not a misnomer, but it truly does work. And there's many different brands. Now, let's dive deeper into some that have some evidence-based therapy. So when you're looking at scar wound healing gels, you should at least have vitamin E and vitamin C. These are antioxidants that help stimulate collagen production. And even the use of tranexamic acid has some early data to support that it enhances wound healing. But these all stimulate collagen production and reduce oxidative stress and inflammation. And they really brightens and gives you more uniform pigmentation in the scars. So you apply it once or twice a day. And, the key also is, in combination with silicone gel, it's optimal. So you put on the vitamin C and E topical, then you put a silicone gel on, it's optimal. And the other thing is always use a sunscreen, because if you get sun into a early scar, it'll hyperpigment and it may be irreversible. So that's very, very important. So there's combination treatments. And again, I'm not here to sell you anything, but there's many different vitamin C serums from SkinCeuticals to Revision. These are all excellent. And the vitamin C is really, it has to be one that is really, that's absorbable. And then you can also get vitamin E oils as well. You can combine the two together. And then the fourth one is Centella asiatica, which is Cica cream. It really has been shown scientifically to enhance fibroblast proliferation and reduce inflammation and enhance collagen synthesis. And it really does improve and minimize scar thickness. And again, you apply it after the wound's been closed and healed. And really, it's really great to use it, up to 2 to 3 weeks or longer in early postoperative wound healing. So this also works very well. It comes as a scar recovery gel from Skin Medica and multiple other types of places, but it truly has some great science to it. So the key here is you're combining these strategy for optimal results, meaning that you want to focus early on proper wound healing and proper wound closure and infection prevention. And like I said, meticulous closure, layered closure, getting the skin edges correctly, seeing how it does sunscreen, sun protection. Then at weeks 3 to 4, if there's any evidence of redness or anything, use silicone gel for 6 months, use medical grade honey, and then see how it does continuous silicone healing, and then use vitamin C and or E and Centella asiatica gel for scar refinement and gel. So this is a combined treatment regimen to optimize results. And I'll tell you, the key is you want to have a seamless looking scar in a patient, whether it's around a facelift. I mean, most of the time I'll just use a normal postoperative wound healing regimen, which has got a hyaluronic acid in it. And then after a month, we'll begin using, the vitamin A, vitamin C, and vitamin E antioxidants. And really, that's the takeaway. And avoid the sun. So those are the 4 science-based ways of actually not only making a normal scar look better or almost invisible, but making an abnormal scar heal to become a normal scar. And the key is prevention. Once you have a keloid, once you have a hypertrophic scar, it's so hard to treat it. Many times you'll have to, go back, cut it out, and then begin this prophylactically immediately after surgery. And then if all else fails, and this is a topic for another podcast, and actually a podcast I did recently that actually how you can use X-ray therapy or slow-dose radiation therapy to treat or prevent keloids in patients that are prone to such problems. So stay tuned, and we'll talk about that again at a future podcast. So those are the key takeaways. Know before you go. And the key to a great outcome is great surgery, great precision, great technique, and thoughtful and science-based aftercare, as I've talked about. So give me your comments, give me your thoughts, send me your thoughts about how you've healed after your surgery and what you've had done, so we can actually talk about it potentially at a future podcast. So until then, stay safe and stay informed.